update that we do on Mondays to give people in the Eau Claire area information about where we are at with testing and disease cases for COVID-19, to share some information as we have disease progression happening in the community, and to answer questions. Today is Monday, July 20th. So first of all, I hope people had some time to enjoy outside this weekend. I know that I got to get outside yesterday where the weather was a bit nicer. The day before was not so nice. But it was good to have a little time, and I hope people were able to do that safely. Taking some time to do things that take care of ourselves and our families is always good. Today we do have Luke Feedy again to talk a little bit about mental health, and we welcome him as all of us struggle with something that is so unusual as a once-in-a-century kind of pandemic. This is not something that is easy, and something that happens so rarely that it's a good space and time to be reminded of the challenges and the opportunities that we can have to take care of each other. I'll share some state numbers and some Eau Claire numbers, and Luke will share some time with us, and then we will do some answering of questions. Again, overall, a reminder that COVID19eauclaire.org is a website to go to get current information on COVID-19 in Eau Claire. It does have data that's even more extensive than what we shared during this time, and it has lots of additional information for individuals, for families, and for businesses. So the state update. Total negative counts of COVID-19 for numbers of tests done are at 737,191, an increase of over 6,000 tests since yesterday. Total positive cases of COVID-19 are at 43,018, an increase of 703 since yesterday. Total hospitalized are at over 4,129, an increase of 22 people hospitalized. And we now have 846 individuals that have died, an increase of 2 individuals. Wisconsin does have some of the highest case numbers the last few days, and that has continued over time, and an increasing positivity rate for the state. That daily positivity rate has stayed in the double digits for a number of days now. It does mean that we continue to see challenges with COVID-19 in our state. Negative test results for Eau Claire. We are now at 11,570 negative test results for COVID-19, an increase of 451 tests since Friday. Positive cases are at 402, an increase of 31 additional cases since Friday. And we've had our second death in Eau Claire. We now have 2 people that have died of COVID-19 in Eau Claire. Again, these are Eau Claire County residents. The individual that died over the weekend was someone under the age of 50, and that individual did have underlying conditions. It is tough when we continue to have positive cases, and also tough when people that are residents of this community die related to COVID-19. We are now at 322 individuals that have recovered, meeting that state definition for recovered from COVID-19. Every Monday now we're reporting information on the jail as well. We have 37 people tested for COVID-19 connected to the jail, 7 positive cases, 6 are recovered, 1 is remaining in that positive status. Our test results continue to vary over time, and our daily positivity rate and our daily percent positive, as we've talked about, has remained fairly steady the last couple of days. A couple of local announcements. We'll share a bit about schools. We have had a COVID-19 incident command team that has been working with schools since really this spring. Certainly, that K through 12 school group has done a lot of work recently. We've been working with the DPI guidance to make sure that all school districts in Eau Claire County, both public and private, have opportunities to walk through that DPI guidance, to use the screening tool that they have available, and to have resources as they consider their plans for reopening in the fall. Whether the schools open or do not open is really the decision of a school and a school board. It is informed by what is happening with local disease, and we are in very close connection with all schools about their plans. We will continue to do that work. Our children and the staff and faculty that work in schools are a critical part of our community. We want to make sure that people are staying safe and healthy in that environment, and we want to make sure that as we are able to, that kids have that experience of learning. It's critically important for them and for their families to have those opportunities. I'm a mom of 4 kids that went through the Eau Claire school system, and certainly understand how strong of an educational system we have here, what dedicated leaders we have, and how important these decisions are as they move forward. So I will turn it now over to Luke Feedy, who will share with you a bit of an update about mental health, and then I'll be back to close and to answer questions.
Thank you, Liska. Happy Monday afternoon to all of you. As we move closer and closer to the beginning of the academic year for our children, many of us have found ourselves weighing safety, education, and well-being for our kids. This decision-making, whether to send our children to a physical school or virtual school, has been anxiety-provoking for many of us. There are still many unknown pieces to this pandemic, and it's often the fear of the unknown that keeps us up at night. The anxiety around this decision is real, and making the right choices for our children and youth is fraught with unique and unprecedented challenges at this time. As we all work to navigate these uncharted waters together, there are a few things that we can do to make this process easier for all of us. One is a simple skill, that all of us have. We now, more than ever, need to be kind and patient with one another. Kindness and patience are simple tools that allow us to support one another and to understand one another. Much like cough syrup for a cold, kindness can help us mitigate the symptoms of this pandemic. Kindness is not the cure for this pandemic. Kindness and patience will not make COVID go away, but they can allow us to move through it much more bearable than we have been. We all have our opinions, our thoughts, our reactions to what we see and hear. We must not rush to judge one another's decisions. If we take time to understand one another before being understood ourselves, we often find that we are much more alike than we are different. We are a strong and vibrant community here in Eau Claire. We can serve as a model for other communities by practicing patience and kindness with one another and intentionally seeking to understand the viewpoints and decisions of our friends, our family, our coworkers, and our community members. On a final note, I want to take a moment to celebrate our local educators and educators across the nation. The teaching of our children and youth is essential. Many educators are working to prepare for an unprecedented school year, all while working to balance the health of their students' educational needs, and their own health. From all of us here at the Eau Claire County Department of Human Services, thank you. Thank you for your work. We look forward to growing stronger together. Thank you.
Thank you, Luke, for sharing that. And I will add my thanks to teachers. They do amazing work every day that they are with our students and are particularly doing an unprecedented job to meet needs of our kiddos across all kinds of circumstances. So my thanks as well is added to that. A couple of closing comments. Remember to stay tuned to our website to get updates and information. It is a resource that has all kinds of resources for people. One of the things that we continue to talk about, and we have resources that are shareable on our website, are about using face masks. My reminder to everybody is that we can do two really clear things for one another. One is keep 6 feet distance. What we're doing in this room is about keeping 6 feet distance. The second is wearing a face mask. There's clear evidence that doing those two things will make a difference in slowing the spread of this disease. We're not going to stop all spread, but it's our responsibility to really step in and work on slowing the spread. And those two things are things that are not hard to do. They do not take much effort, and we can and need to do both of them. So we'll be back on Wednesday. We'll talk more about the recent data. We'll stream that on Facebook Live, and we will continue to update you as new information is available. And Luke and I are available for questions. Yeah.
Let's specifically talk about the Eau Claire Back to School plan. What are your thoughts on that, especially given since some of the bigger districts in the state, Madison, Milwaukee, are starting on virtual? So what are your thoughts on the hybrid model that they're going to talk about at school boards?
Mm-hmm. So Eau Claire Area School District will be meeting tonight to talk about the plan that they announced last week. We've been working closely with Eau Claire Area School District as well as all of the other schools in the area to really look at options to meet the important recommendations that DPI has put out, as well as the requirements in our public health order. So Eau Claire School District, as are all school districts, looking at that for Eau Claire County. Maintaining 6 feet, wearing cloth face coverings are critically important parts of moving forward, and Eau Claire School District is looking at both of those measures. They're making sure that 6 feet distance can be maintained, and they are looking at additional ways to make sure that kids and staff are protected. Their hybrid model is one of the ways that DPI proposed moving forward, and they are utilizing that in their plan at this point, and is certainly one way to meet needs in the community given where disease spread is now. Again, staying home when people are sick, making sure we keep physical distance are really the best ways to prevent disease, and Eau Claire is approaching it that way. Other questions today? Yes?
A few on the person who died recently of cancer. Can you say how they contracted the virus?
So the question is related to the individual that died of COVID-related issues in Eau Claire over the weekend. I am not aware of the actual connection between that person and another case, whether it was community spread or a close contact. So I don't have that information.
Can you say their gender and if they were hospitalized?
So I can share both of those things. It was a female, and she was hospitalized, and she was under the age of 50. Any other questions that anybody has? Yes.
This might be a question more for Luke or
Mm-hmm.
you, but from the behavioral health perspective, what are the negative effects that could come as the weather gets colder, the days get shorter? What are you guys thinking about?
Sure. So Luke, I'll have you come up if you'd like to share additional, but the question is related to what are the mental health implications of winter, a season that comes every year. What are the implications for that with COVID-19, presumably? And I'll certainly share that there, from a health perspective, as a health department, lots of opportunities and lots of ways of staying healthy in colder weather. In fact, last winter, you may remember, we did a whole project related to social isolation and health in the winter and ways to find positive opportunities to get outside and be socially connected as well as physically active. So we'll continue that this year, but I will have Luke share some additional information.
Yeah, happy to weigh in on that. So one of the things that we've noticed or have seen within the behavioral health field is that often COVID-19 will act as an amplifier for mental health conditions that already exist. So if someone is already prone to depression and or anxiety, this hasn't made anything better. And so for individuals who deal with any kind of seasonal affective disorder, the isolation is worse now than it ever has been. And so moving into the winter months, it would be important to develop a robust plan, put in some preventative measures, things that we know help mitigate some of those symptoms, and really adhere to that routine. So I think for anybody who knows that they struggle with seasonal affective disorder and have had issues in the past, knowing full well that this might make things a little bit harder as they move into the winter months. So again, it really amplifies a number of mental illnesses that people have now.
Thanks, Luke. Any additional questions? All right, thank you for joining us today. We will be back on Wednesday via Facebook Live, and we'll join you then to share an update at that point in time. Thanks.